Hello, everyone. I'm Dr. Debolina Mukherjee, and I welcome you all to the very first episode of our monthly podcasts from the Indian Epilepsy Association called the Epilepsy Voices of India. And it seems like a very opportune time to start off with this program, especially with our National Epilepsy Day around the corner. Epilepsy, as we know, is a common neurological disorder that has affected several people worldwide and with quite a huge burden in India. And unfortunately, it often remains shrouded in various myths, misconceptions, and stigma. With this regular program from the Indian Epilepsy Association, we hope to raise awareness about epilepsy, address the many questions and doubts of people with epilepsy while empowering them. And today, we feel extremely privileged to start off this program with Dr. Gagandeep Singh, sir, who will be enlightening us on our very first topic, which is Epilepsy First Aid, what everyone should know. Dr. Gagandeep Singh, sir, is professor and head of the Department of Neurology, Dayanand Medical College, Ludhiana. He is the president of Indian Epilepsy Association and an executive committee member of the International League Against Epilepsy. He is also the honorary professor of the Department of Clinical and Experimental Epilepsy, UCL Institute of Neurology, Queen Square, London. Thank you so much, sir, for joining us today.
Thank you, Debolina, for this wonderful introduction, and thank you so much. More so, thank you so much on behalf of the Indian Epilepsy Association, the entire epilepsy community in India and worldwide, for having taken up this challenging task of online education, online awareness raising about epilepsy, not just in the country, but worldwide through the Indian Epilepsy Association YouTube channel. Thank you so much, Debolina, for this. This is a huge task, and thank you for taking responsibility for this.
Right. Thank you, sir. I also hope that this will be beneficial for a lot of people. So let's start off with the question-answer session. Sir, please tell us about seizures and epilepsy and how should we identify them?
Debolina, that's a loaded question. Yes, seizures and epilepsy come in many different forms, in many different shapes and sizes. Trying to get hold of all types of seizures and all types is indeed a challenging task for even neurologists, right? Some of the common seizures are the tonic-clonic seizures. So in the tonic-clonic seizures, which are very easy to recognize, and fortunately, I think it's not really necessary to be a doctor. Leave aside an epileptologist or a neurologist to be able to recognize most tonic-clonic seizures, right? So that's the good part of it. So at least the tonic-clonic seizures can be easily recognized. And these seizures, they typically begin with a fall, a loud cry, the body becomes stiff, that's the tonic phase. It is followed by a clonic phase in which there are to and fro movements of the limbs. The eyes are uprolled, there is clenching of teeth, there is frothing from the mouth, as I said, a loud cry, and the person is lying on the ground or wherever, right? And this goes on for usually less than a minute. Most tonic-clonic seizures last for less than a minute. Which is the tonic-clonic phase, right? The stiffness and then the clonic movements, right? To and fro movements. They usually do not last for more than a minute. If they last for more than a minute, and particularly if they last for more than 5 minutes, that's a difficult situation. That is known as status epilepticus, and it is a life-threatening emergency, which needs immediate transfer to the emergency service of a hospital and immediate treatment, right? But what happens after this 1 minute of a tonic-clonic phase is the person is usually unconscious, right? And he or she might be unconscious for nearly about 5 minutes, 10 minutes, 15 minutes. They gradually, slowly recover consciousness, right? And if someone recovers consciousness like this, becomes like a switch, an electrical switch, and becomes completely normal. That's probably not a true seizure. That's not probably an epileptic seizure. It's something else, either a psychogenic seizure or something else, right? And then for some time, the person is usually confused. You try to ask him lots of questions and will not be able to reply to those questions appropriately. The responses might be slow, the responses might be delayed, the responses might be inappropriate, right? And during the seizure, a couple of things. There might be incontinence, right? And which means that the person might lose control of his bladder or bowels. And sometimes the patient or the individual with who just had seizures might actually bite his tongue, and there might be a tongue bite, and there might be some bleeding within the mouth or coming out of the mouth during the seizure. So that's a tonic-clonic seizure, right? But as I said, seizures come in many different forms and shapes, different forms, and there are several other types of seizures. And it is important that we need to recognize these other forms of seizures. Some of these forms of seizures are known as non-convulsive or non-motor seizures, which are absolutely, the person might be still for a few minutes, right? Or the person might have some vague movements of the repetitive movements of the mouth or the oro-alimentary apparatus or of the hands, and these repetitive movements are known as automatisms. And these strange movements and complete behavioral arrest, right? A behavioral arrest means that the person is like a stone, right? He's unresponsive. You try to talk to him, he's not responding. He is unaware. And the current term is not awareness or responsiveness, it's consciousness. So they actually lose consciousness. So you try to talk to the individual, he's not responsive. You try to uh, interact with the individual, he's not interactive at all, does not respond, and that also can be a seizure. There might be eye blinks as an absence seizures, very brief. Uh, Students in a classroom, children in a classroom, and there is a class teaching session which is going on, and suddenly you find that they become unresponsive for a few seconds, little bit of blinking of the eyes, and they come around very fast, just few seconds, 10 seconds, 5 seconds, 10 seconds, or so on and so forth, right? So seizures come in many different forms. Um, it's easy to recognize tonic-clonic seizures, but it is also important to recognize the non-convulsive, non-motor seizures, because there are now a number of studies which have emphasized that one of the main reasons for diagnostic delay or a diagnostic gap, which means the diagnosis of epilepsy is delayed because a good proportion of these people just have non-convulsive seizures, and no one realizes that these are epileptic seizures. Some people think this is just a normal kind of thing, and therefore no one seeks medical attention. And sometimes when these people go to the emergency of service of a hospital, the emergency physicians also do not recognize them to be seizures, right? So
Very true.
these non-convulsive seizures are a very important cause or reason for the epilepsy diagnostic gap and epilepsy diagnostic delay, right?
Thank you, sir. So we'll move on to the next question. That is, what are the things that should be done during an episode of seizure, and what are the things that should be strictly avoided?
I think that's a great question, and thank you for um, um, bringing attention to this important aspect. And well, friends, just like Dr. Debalina said, what are the things that need to be done, and what are the things that need not be done or should not be done? And I think that's extremely important. We should know what should not be done, right? So I think the first and uh, most important thing is to ensure the safety of the individual having seizures, right? So, quite often it's a tonic-clonic seizure, but it may not be a tonic-clonic seizure. And the problem with tonic-clonic seizures is that people can injure themselves, they can fall, they can have fractures, they can have injuries, they can have dislocations. A whole lot of things can happen. And then remember that these seizures are a risk um, unfortunately true, for a risk for the person dying, right? So there is something known as SUDEP, sudden unexpected death in epilepsy, or there can be several other reasons. The person might be swimming and or maybe near a pool of water, or might be standing at a height and has a seizure and he falls, or might actually be driving and he has his first seizure at that point of time. So there is a tremendous risk to life during these seizures, right? So it's important to know, and it's important not just for people with epilepsy to know. It's not just important for the carers of people with epilepsy to know. It's not just important for everyone who is somehow connected to someone with epilepsy to know. It's for the general public. So you see a seizure on the road, right? You don't know the person, but what do you do at that time, right? Some people might put something into the mouth. Some people might put a spoon in the mouth. Some people might put some keys in their hands. Some people might gag them, right? Some people might give water to them during the seizure, right? Which these are things not to be done, right? But then again, coming back by what is to be done, and let's take the case of a generalized tonic-clonic seizure, right? So the first thing is to ensure safety. If the person is wearing specs, take out these specs. It should not be anything around which can injure them or harm the people, right? There's a fire, it's near a fireplace, get him away from the fireplace, right? If there is a body of water and there is a chance that he might fall, or it's a height, get him to a safe place, right? So the first thing is to ensure the safety of the person, right? Now, one common misconception is when a person is having a tonic-clonic phase, the initial reaction should be to shift the patient to one side, right? Or turn the patient to one side. Now, what happens, and there are some very good studies this, when people dislocate their shoulders during seizures, during generalized tonic-clonic seizures, usually the dislocated shoulder is the one which is below, right? On the side to which the person has been turned. So turning the patient during the tonic phase, or perhaps sometimes even during the clonic phase, very early, can actually increase the chances of shoulder dislocation, particularly on the side which is below or the side to which the person has been turned. So for the initial period, let the patient lie on his back, right? But as the seizure starts abating, it's good to turn the patient to one side. So that will ensure that the tongue does not fall back. If there is any frothing or accumulation of saliva or secretions in the mouth, they all come out as a result. You can pat him gently on the back. That might actually encourage the patient. Patient is, of course, unconscious, but at least some of the secretions to come out, right? and be with the patient. It's extremely important to be with the individual as long as he's having seizures. People are crowding, just reassure them, nothing, fine. We're taking care of the patient, right? We're taking care of the seizure, right? And also extremely important, and this is something which is often missed, and I often tell all the family members who accompany people with seizures is to time the seizures, right? It's extremely important to time seizures, right? There is a lot of confusion at that time. People panic, so this often does not happen. But if you're not panicking, if you are in command of the situation, it really helps. And then if you are in command of the situation, just time the seizure. What time did it begin? What time did it end? As I said, most tonic-clonic seizures last for less than 1 minute. And if a seizure lasts for more than 5 minutes, it is called as status epilepticus. The patient needs to be transported immediately to the emergency, nearest hospital emergency service, and intravenous drugs need to be given to stop the seizure, right? So, which is why it is extremely important to time the seizure. Most often it is not done. I completely understand it's a panic situation. People think that it is the end of the world. The witnesses think it is the end of the world. But if you can time, it would be great. It gives a lot of information to the treating physician, right? What time did the seizure begin? When you get the patient to the hospital, it gives a huge amount of information to the emergency doctor there, right? So another thing that can be done is we all have cell phones, right? And all cell phones, smartphones have cameras, videos, right? So it is usually a great idea to make a video of the seizure, right? Because once the seizure is over, you would seek medical advice, right? And therefore, if you have a video recorded of the seizure and you show it to your doctor or physician or neurologist or epileptologist, it would give him a lot information about what kind of seizure it was, right? Uh, but if you're alone, if you're panicking, then please forget the video. Safety of the individual who's having seizures is the most important thing, right? So usually making a video is generally not possible on the first occasion, right? But then as people get used to it, carers and family members get used to it, then, and if there are more than two people witnessing the seizure, two family members, then one of them can focus on safety of the individual and the other person can do the video, right? But if you're making a video, I have three important recommendations for that. The first is try your best. It may or may not be possible. Try your best to make the video right from the beginning till the end, because the beginning part of the seizure is the most important. It gives the greatest amount of information regarding which part of the brain did the seizure begin from, right? Okay. So beginning to end, right? Please go back about 4 to 5 feet away from the individual who's having seizures and then make the video, right? Because if you get too close, we want to know what's happening to the entire body. What are the kind of movements that are happening to the entire body? So if you do a close up, right, go just near the face of the individual who's having a seizure, you might not get that kind of information. So please go back about 4 to 5 feet and then make the video so we get to know what kind of movements are taking place in the limbs, in the face, in the body. So that gives us more information, right? And then it should be done in a well lighted room. So it's middle of the night. So it's a good idea to switch on the light and then record the video, because a dark room recording may or may not provide enough information. So I think these are some of the things that need to be done. What does not need to be done is also extremely important, as Dr. Debilina clearly emphasized. Do not put anything into the mouth, right? Some people put a spoon, and I've had an instance where the spoon actually broke into two and one half went inside. Some people will put their fingers into the mouth of the person having seizures. Their fingers get bitten, right? Don't do that. I mean, the idea is you completely understand you're trying to prevent a tongue bite, right? But if it has to happen, it will happen. And if it's not a tongue bite, it might be your fingers, right? So don't put anything in the mouth, right? Do not give any water to the patient during or immediately after the seizure, right? Because many people after their seizure might actually throw up, right? They get sick, they might vomit, right? So if you give water, then the chances of throwing up will actually increase, right? They might aspirate, all this water might go into their chest, right? And then they will have a pneumonia. So that's also not a good idea. Don't give anything by mouth, right? Okay. Do not well, many people would put some keys into the hand. It's pretty much not required, right? Some people might make people smell shoes. It has no basis, right? It's a big myth that smelling shoes can abort seizures, right? So it has no basis. Another thing important to emphasize is that most seizures would stop on their own, right? Now, therefore, it's not necessary that you have to rush the patient to the hospital, right? Someone who's having seizures, most seizures will stop within 1 minute, and the person will recover consciousness in about 10 minutes. The first time someone is having seizures, it's a pregnant woman with seizures. And most important, if the seizure, time the seizure, and the seizure is lasting for more than 10 minutes, more than 10 minutes, sorry, did I say 10 minutes? No, more than 5 minutes, right? That is status epilepticus. You need to take that patient to the hospital emergency immediately. Otherwise, most seizures would stop on their own, less than 1 minute, recover consciousness in 10 minutes, and therefore it's not necessary to rush the individual to the hospital. Every person with seizure need not be rushed to the emergency. So these are some of the things that should not be done. That's extremely important.
So, a lot of patients are often prescribed nasal sprays. So,
Right.
what are the actual indications and how should we use them?
Thank you. And Dr. Debilina, that's also a very important question. It's actually a loaded question. And I'm actually delighted to mention this to everyone that the Indian Epilepsy Society and the Indian Epilepsy Association recently had applied for a small grant. It was a very competitive grant for which there were 80 applications from across the country. And we were placed very high, and we actually secured that grant, trying to develop an answer to the very question which Dr. Debelina has posed to me, right? What are the indications, or when do you use a nasal spray in someone having seizures, right? So this was the EPI-ACT grant by the International League Against Epilepsy. So currently the Indian Epilepsy Society and the Indian Epilepsy Association have set up a task, are setting up, in the process of setting up a task force to look into this, uh, because what Dr. Debalina is asking is, now there are many nasal sprays. You just spray it into the nose, and these sprays contain benzodiazepines, liquid benzodiazepines, which get rapidly absorbed across the nasal mucosa or the nasal lining into the bloodstream and can be helpful in aborting seizures, right? Now, the a very broad answer. Now, the IES and the Indian IEA, the task force will look into specific indications, India specific indications for using the nasal spray and out of hospital treatments. They can be immensely useful. But as I said, most seizures do not last for more than 1 minute, right? And so therefore seizures stop on their own. And therefore this nasal spray is really of no use. It's reassuring to the family that yes, we have something which can get help us be in control of the situation, but really it doesn't help. There are some specific indications, particularly in children, when children have lots of seizures or seizure clusters, one seizure, then another seizure, and then another seizure in rapid succession, right? Over, let's say, 6 hours or over 24 hours. Or has a very prolonged seizure, as I said, lasting for more than a minute or so, right? So in that kind of situation, yes, nasal sprays can be really life-saving. They can be effective, very effective in terminating or stopping the seizures, because it can take time. In India, it can take a lot of time to transport the individual who's having seizures to the emergency facility. It might be very long, very far away, right? Might take an hour to reach the hospital, right? So we don't have helicopters transporting our patients, right? Ambulance services are also difficult to access, right? So therefore, it can be extremely useful. Suffice to say, only in prolonged seizures, people who have repetitive seizures or seizure clusters, as we call them. But the Indian Epilepsy Society and the Indian Epilepsy Association are looking into this, and we would have firm answers very soon on this. I'm sure that would be a topic for one of the future YouTube
Absolutely, sir.
presentations. Right.
So another question. There are many triggers for epilepsy. So what are the common triggers that we should look out for and how to avoid them?
That's also a great question. And people with epilepsy can have seizures, and it's important to know what triggers these seizures, right? So triggers usually are in immediate uh, proximity or temporal relationship to the seizures, right? So I think some of the common triggers, and this is very important in adolescent onset epilepsies which begin about 12 to 14 years of age, and they are generalized tonic-clonic seizures. So, particularly in adolescent onset epilepsies, these triggers are extremely important. I think two of the most important triggers are one, sleep deprivation, lack of sleep, right? And people miss out on sleep. There might be a marriage and or a jagrata, as we call it, and the person has not slept the entire night, or it might be an exam, right? And the uh, person is studying for the exam, has the exam the next day morning, and keeps up the whole night, preparing for the exam, goes to the exam and then has a seizure. So lack of sleep or sleep deprivation is a very important trigger for seizures, right? And particularly in some of the adolescent onset epilepsies, we call that, they go by different names. Juvenile myoclonic epilepsy is one of them. The other trigger is alcohol and drugs and substances which can be abused, right? So excessive alcohol, um, withdrawal from alcohol in people who are taking a lot of alcohol over long periods of time. All of these are important triggers, right? So, and then you have few rare conditions. Stress can sometimes trigger seizures. Periods can trigger seizures. We call it as catamenial epilepsy. Um, uh, Yeah, these are the common triggers. But the two most avoidable triggers are sleep deprivation, simple, sleep in time, 1 or 2 hours this way or that way doesn't matter, but generally sleep in time, get up as usual. And the second important trigger is alcohol and drugs, which can certainly be avoided. You'll agree with me, Dr. Gabali.
Concluding question, sir. What are the basic measures that people with safety measures that people with epilepsy should follow?
Uh, that also is a question which probably has a long answer, but to cut it short, few important things. People with epilepsy need to avoid things um, in which they can compromise their safety, or injure themselves, or even die during seizures. Right? Okay. So someone is having seizures. Driving is a big question. At the moment, uh, I don't have definite recommendations for you, but I can tell you that the Indian Epilepsy Association and the Indian Epilepsy Society are already perusing this with the authorities across the national authorities, the Transport Ministry and the Health Ministry, and this particular law or bill is doing rounds in the ministry, and we are extremely grateful to both the ministries and a whole lot of active members of the Indian Epilepsy Association who are pursuing this matter with great amount of enthusiasm and great amount of vigor, right? But yes, someone is having seizures very frequently or is continues to have seizures. Driving is a big issue. Um Things like swimming, deep sea diving, cooking on the open fire. Someone is has frequent seizures and is cooking on an open fire. So these are some of the things one needs to think about and are important from the safety perspective. Uh, but as a recommendation, what we should do, we should really be mindful of the cultural sensitivities. India is a huge country with many different cultures, many different perceptions. So whilst approaching these kind of issues, we really need to be culturally sensitive and be very sensitive to what the feelings of the community are regarding all these issues, and then take these forward with people with epilepsy.
Thank you so much, sir, for joining us today and in giving us your valuable time. And thank you so much for all your wonderful insights and opinions. I'm very sure it will be beneficial to a lot of people. If you have some final message for our listeners today, sir.
Uh, um, My final message is, Dr. Debalina, I'm absolutely delighted as the president of the Indian Epilepsy Society that this today, the first inaugural issue of the or inaugural recording of the Indian Epilepsy Association YouTube channel is taking place, and I think I am extremely grateful to you, and I'm absolutely delighted that you have taken this up, and I wish this YouTube channel an absolute success. Week after week or month after month, the way you have planned is fantastic, and I wish it all success, and I wish all the messages in this and future YouTube, future editions of this channel really reach all the people it is supposed to reach across the country, and it really makes life completely different for people with epilepsy.
Thank you so much, sir. And thank you to all our listeners for joining in today. And we, on behalf of the Indian Epilepsy Association, hope to continue our endeavors in epilepsy care. Thank you for joining.